Hi, this is Jean Seebacher, and this is my video for class 3280. I'm having a little technical difficulties with my laptop, so I'm using my phone to do this. I hope this works. So I'm going to continue. So next I'm going to check out the heart. So I've got my patient laying down. I'm inspecting for heaves, of which I do not see any. Next I'm going to palpate the precordium for the apical impulses between the fourth and fifth around mid-clavicular, and I do feel an impulse, but not a thrill. Next, I'm going to auscultate the heart for the apical rate and rhythm. So I'm just going to listen at the apex of the heart, and I'm going to listen for 15 seconds, and then I'm going to multiply it by 4. So this patient's got a regular rhythm, and their heart rate is 78. So on my last video, I did listen to all the heart sounds with the diaphragm, so now I'm going to listen with the bell. And I'm going to listen to the aortic, the pulmonic, the herbs, the tricuspid, and the mitral. I'm listening for any irregularities. I'm hearing my normal S1 and S2 sounds. I don't hear a murmur. I don't hear any irregular sounds. If this patient did have a murmur, it could be heard on the neck, back, or the axilla. And in innocent murmurs in children, sometimes when the patient sits up, the murmur can no longer be heard. So, next patient, can I have you sit up, please? Mr. S. So I'm going to check the I'm going to check the radial and ulnar pulses. So I'm going to check the radial and the ulnar pulses on both arms. They're both a +2. I can do a modified Allen test on this patient, in which I depress both the radial and the ulnar artery. Put your hand straight for me, please. So that when I let go of the ulnar, all the color should come back to the hand. So that is a negative test. So I'm going to have you lay back down again, please. So I'm going to check I'm going to look at the neck, and I'm going to inspect each side for jugular venous pulse. So I'm going to check for the venous pulse on either side of the neck. There is no bruit. I do not have any swishing or bounding pulse on either side. They are both palpable, and they're both even in rate. So next I'm going to check the abdomen. I'm going to check all 4 quadrants. I'm going to listen to my stethoscope. I'm going to start in the right lower quadrant, work my way up and around to the left upper and then the left lower quadrant. My bowel sounds are normal active. Next, I'm going to auscultate all 4 quadrants of the abdomen. I should have a tympanic sound to all of the 4 quadrants. So next, I'm going to do light palpation and then deep. Does that hurt at all?
No.
Any pain or tenderness?
No.
So upon light palpation, there is no pain and tenderness. I'm going to do deep. On deep palpation, there is no pain or tenderness either. However, I am not able to palpate any of the spleen, the liver, or the kidneys. Next, I'm going to look for varicose veins in the legs. Upon inspection, I do not see any kind of varicosities in the legs. I actually forgot to palpate the groin. So I need to check for the femoral pulse, which I am able to palpate. And I'm going to check the inguinal area for any tenderness or any palpable nodes. Does that hurt at all? Patient?
No.
Okay. So no masses, no tenderness in the groin area, in the inguinal area. So I'm going to check the popliteal pulse. I'm going to check the popliteal pulses behind the knee on either leg. They are a +2. I'm going to check the pedis pulse, which is the top of the foot on either foot. Those are both +2. And I'm also going to do the pretibial, which is around the ankle area. And I'd say those are a +1 bilaterally on this patient. I'm going to check for calf tenderness by compressing the calf. Does that hurt at all? I have no calf tenderness on either side. Next, I'm going to check the range of motion to this patient's hips. Can I have you lift your leg straight up in the air for me while keeping the other leg straight? How high can you lift this?
Oh, right there.
Okay, we do not have full range of motion in the flexor of the hip. How about the other leg? Oh, excuse me. Good. And we do have better flexion in the right hip than the left hip. Okay. So then I'm going to have you bend your legs. Okay. Are you able to rotate? Oh, straighten this one out actually. Sorry about that. Can you rotate this hip out this way? How far can you go?
Oh, right there.
Okay. We do not have full extension of that, or excuse me. Can you do this one? Okay. We're looking for external rotation and internal rotation. Okay. I'm going to have you straighten your legs. And I'm going to have you keep your leg straight. Can you bring your leg out straight to the side? How far can you go with that?
Right there.
Okay. And then can you, okay. All right, put your legs together. And I'm going to have you take this one, and are you able to cross over this way but keep the leg straight?
Mm-hmm.
Checking the adduction versus, okay. Adduction versus abduction. Okay, next we're going to check the knees range of motion. Can I have you sit up, please? Okay, could you straighten your leg out for me on your right leg? So we have full extension of the right leg. And bend it. All right, how about the left leg? We have full extension of the left leg. So the knees are better range of motion than the hips. So we're going to do the feet. So can you straighten your leg out for me? Okay. So I want you to point your toes. So we have plantar flexion and then dorsiflexion. So that's the right foot. Okay, can you do the left? So we have plantar, slower. Straighten them, point them out. Plantar flexion and dorsiflexion. Can you do, so with your foot flat on the ground, are you able to turn your foot inward without moving your leg like this? So we do not have flexible inversion. How about rotating it out like this? No, nope, straight like this. No, put your foot flat on the ground and rotate your foot out like that. Good. So we have eversion but not inversion. How about the left foot? We have eversion, not inversion. Okay. So bear with me. Okay, next. Okay, so we're going to check the patient's neurological response. Can you close your eyes? We're going to just do a light touch. Can you tell me where I'm touching you?
Side of the face. Chest. Back of the hands. Top of the leg. Feet.
Okay, so patient was able to distinguish light touch to all of those body parts. Now we're going to do a firm touch. Tell me where I'm touching you.
The foot, top of the foot.
One or both?
Both.
How about now?
Top of the leg, both. Top of the hand, both. Top of both hands, side of the face.
Okay. Okay, next we're going to check cerebellar function. Can you open your eyes for me? Can you touch your nose with your index finger? Can you touch my finger? Can you touch your nose again? Good. How can you do it with the left hand? Touch your nose, touch your finger. So that is intact. Patient is able to do both. One, great. Patient is able to touch finger to nose on both sides. Can you lay down for me? So I'm going to have you, can you take your ankle on the opposite leg and run it up and down your shin? All the way, nice and slow. Okay, can you do it the other way? So patient is able to do that test bilaterally as well. So cerebellar function is intact. Next, so the final thing we're going to do is we're going to do musculoskeletal. Okay, can you stand up for me, please? So I'm going to have you walk across the room. Patient has even, steady gait. Okay, next I'm going to have you, can you walk towards the door heel to toe? So one foot in front of the other. Patient is able to do that relatively well as also. Can you walk on your tiptoes? Steady, even gait, smooth, no stumbling. Okay, I'm going to have you, can you stand still for me? Put your heels or put your feet close together and close your eyes. This is checking balance. Patient just has a very light sway. Thank you. Can you do a shallow knee bend for me? How far can you go? Okay, patient is able to do a shallow knee bend. I'm going to check spinal range of motion. Are you able to lean forward and touch your toes? Patient does have full forward extension. He is able to touch his toes. Are you able to lean back? How far can you lean back? Patient has minimal extension of the spine. Thank you. That is the end of my I think I have 5 videos for the final exam, physical assessment for Nurse 3280. Thank you.